Now, the summer season has yet to begin, but the sizzling conditions right now pose risks to everyone as they find ways to stay cool. Now, to talk about the impact of the heat index on our own health, as well as illnesses like dengue and some others we're monitoring, Health Assistant Secretary Albert Domingo now joins us live in the studio. It's a beautiful day, and welcome back, Asec Albert, the fourth host, I believe, of the show.
It's indeed a hot, beautiful day, Paolo, Anne, and Monica. Good morning to everyone, and thank you for having me again here.
All right, so let's focus on the heat indices here because
Yes.
we've been doing the weather here for quite some time and the heat indices have been soaring. Again, yung kapag heat index, it's the temperature, the feels like temperature, the
Yes.
temperature we all as people experience. It's different from the temperature without the humidity and all
Correct.
of that. And when we take a look at the soaring numbers here when it comes to heat indices, are we seeing a rise of heat-related afflictions, in particular in those locations with high heat indices?
Indeed, Paolo, the heat is on. I've been always wanting to say that. The heat is on, and in Tagalog, it's damang init. We
Yeah.
have to distinguish between the absolute temperature. When Pag-asa says it's the heat index, it's the feeling on our skin. And yes, the numbers are going high, but to assure our public, there are 4 levels. There is caution, extreme caution, danger, then extreme danger. There are cutoffs. In particular, the effects can be correlated to 3 heat-related illnesses, in Tagalog, sakit ng init. If you reach already extreme caution, we are at more risk of the first one, which is heat cramps, which means your muscles can go cramping because you get dehydrated, you lose electrolytes. And then if you go to danger, you are at risk, we are all at risk now for heat exhaustion or pagkahapo in Tagalog. You might lose consciousness or feel tired. And then the third one, the most extreme, is the extreme danger. Then you can already have what you call a heat stroke. Heat stroke, you lose consciousness. You can sometimes get disoriented because you basically are drying up, so to speak.
So, Doc Albert, what are the measures that the DOH is carrying out, to mitigate the health risks associated with such extreme heat conditions?
So first off, there's an information campaign. Along with the initial declaration of Pag-asa, they haven't actually even declared the summer. So officially, it's not yet summer according to Pag-asa, but the heat is already starting to go up.
Okay.
So the information we have to give out to our public, tips like cooling off, going to the shade, avoiding the sun from 10 a.m. to 4 p.m., being very mindful of reflected heat, especially here in the city where there's a lot of concrete.
Yeah.
You may be in the shade, but if you're walking alongside EDSA or a big road, the heat coming from the concrete or the asphalt is still puts you at risk of the heat illnesses. And we also have a coordination with local governments to set up cooling stations. This is not a new structure. It can be as simple as coordinating with a local mall. And from our understanding, the malls love this because people are encouraged to go there,
Yeah,
right?
yeah.
And I think that is a form of public service. You should have large open spaces that are well ventilated for those structures, air conditioned. Some barangays even have, I remember from previous years, they would have synchronized movie shows for their senior citizens.
Okay.
So exactly. So for those who are extremely at risk, especially the aged, the infirm, in areas where not everyone's air conditioning, the barangay hall might be air conditioned, and you could actually have schedules from 10 a.m. to 4 p.m. so that they can cool off.
Now, Doc Albert, I want to move on from the heat to another prominent virus that's happening right now that I don't think people are really talking about, the hand, foot, and mouth disease. I
Yes.
know the DOH reported that close to 7,600 cases from January 1 to February 22, just this year. That's 3 times higher than the same period last year. What is the reason why it's going up right now, and how can people spot that?
So hand, foot, and mouth disease is caused by the Coxsackie-A virus. It is a self-limiting disease. It only takes around 7 to 10 days. The fatality rate is very low. In fact, in 2024, there were only, if I'm not mistaken, 2 fatalities. Every life is precious. We don't want people to die. But in public health, having very low fatalities is a good sign to look for. So having said that, what are the symptoms? That's why it's called hand, foot, and mouth disease. There will be small blisters around the hands, feet, and the mouth. and also sometimes at the hind area. So you could have that. You can have fever. Some will have other symptoms, sometimes headache or body ache. But most importantly, it's the rashes that are prominent. And to avoid it, we have to have personal hygiene. Don't come into close contact. Wash your hands frequently, at least 20 seconds. For those who are mostly affected, the young kids, the schools have been suspending face-to-face classes because you simply have to pause physical interaction, allow for the facilities to be decontaminated, cleaned, so to speak, and then you can resume after 1 week.
Yeah, it feels like the classes are being suspended either because of the heat index or because of the hand, foot, and mouth disease. The majority of the cases have been in Metro Manila and have been in Southern Luzon. Has there been any intervention from the DOH to try and mitigate this? I know the fatality rate is not high, and that it's not necessarily a disease that would cause panic, but still, are there any measures from the DOH?
So as we mentioned, we are coordinating with the schools through the Department of Education. We are coordinating with barangays through the Department of Interior and local government. But essentially, to break transmission, it's all about personal hygiene, which means information on what to do is also important. So wash your hands for 20 seconds. It's important. You sing the happy birthday song, right? Of course, don't sing it very slow or very fast. There are different versions. Just sing it for 20 seconds and then you're done. If you can't wash your hands, your mobile or where there's no water or soap, then use your hand sanitizers. That's also equally efficient and equivalent.
You know, I already had hand, foot, and mouth disease, so I know how terrible it is when you have it. Like your hands get super itchy, and you can't sleep talaga. So it's good that you were able to give out these tips to the parents and the schools that are watching us. You know how to prevent the spread of this virus. Now let's talk about the last time you were here. We talked about the dengue cases, right?
Yes.
So as of February 1st, the DOH has reported over 28,000 dengue cases. That's a 40% increase already compared to last year. So what strategies is the Department of Health employing to address this rise in dengue cases?
So earlier this, was it this week or last week? I forget now, but there was a relaunch of the 4 o'clock habit, which we now call alas 4 contra mosquito. It's a very pointed message that at a regular time each day, we have to counter the vector that spreads dengue, and those are the mosquitoes.
Right.
So what do we do? In Tagalog, taob, taktak, tuyo, takip. Sounds like a TikTok song.
Yeah, Papa-English daw
I
para
know,
kay
it's like I really don't know what any of those mean.
Okay, so let's explain. So,
Thank you so much.
so taob, turn it over, because you're talking of the receptacles where the water can collect. Taob. Tak-tak, this is hard to translate. What is
Yeah,
tak-tak?
it sounds like TikTok.
TikTok is when you
Try to get the
When you
water
tap-
off.
when you tap
something.
it or you disturb
Tap
the
it
water.
several
Yes, you
times.
tap
the water.
containers.
Yeah.
Tap containers so that
Tap,
the
tap,
residual water will tap, 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 tap.
Yeah.
So it's tak tak, not tap tap. But
Yeah,
for
yeah,
Mo, it
yeah,
might be
yeah.
tap tap. So taob, tak tak, tuyo, takip first. Tuyo, okay. Tuyo is to dry.
To dry, yeah.
And then takip is to cover. Because sometimes, especially we're heading into the hot season, people will say, okay, the rains are abating, so therefore we will have no longer dengue problems hanging around. But the thing is, during the dry season, people collect water.
Yeah.
So be sure to please cover whatever pails, whatever receptacles you have, so that mosquitoes will not lay eggs into those stores of water.
All right, do you understand, Mo?
I know, I appreciate it. Thank you, Doc Albert, for having to translate that. This is probably the first time you had to do it on air.
Yeah, of course, we are mentioning or monitoring the numbers here. And again, this is a bit off-season, yung dengue. Has the rate of increase slowed as the information dissemination campaign has started at the early part of the year?
So it's Thursday today. Anytime today or tomorrow, the update for the latest data will come in. But as of February 22, we did register a 7% decrease on a week-by-week basis.
Yeah.
We're hoping to keep the trend that way.
Okay.
And to keep that trend that way, we have to keep reminding our citizens, our kababayans, that we don't just do this just because there's an alert or just because it's in the news, and then we forget it after there's a new disease that comes our way. So keep doing it. Alas 4 contra mosquito, taob, tak-tak, tuyo, takip.
All right.
Thank you, Doc. I got all of that.
Yeah.
You know,
We're gonna have a quiz later, Mo, okay? If you could explain it all.
Wait, before we let Doc Albert go, I have this question that I wanted to ask the last time he was here. Because the mga lola natin, di ba, our mga tita, lola, they would say the dengue mosquitoes, they come out daw in the morning and sa late afternoon.
Dusk and dawn,
Is this true?
Yes, yes. So that's a good question. There are, shall I say, 4 kinds of mosquitoes going around. There's your Aedes, there are 2, Aedes aegypti, Aedes albopictus. They are the ones that carry dengue.
Okay.
And they do bite around 6 to 9 in the morning and 3 to 6 in the afternoon.
So, totoo nga. There's
Para
a
silang color
time.
coding. Meron silang oras.
Crazy.
And I've always wondered, so what do they do in between?
They're sleeping.
That's a good question.
Nap sila.
Off-duty sila.
Hindi sila nagtatago sa ayaw mahuli ng coding.
I don't even know if that's a valid question, but I really wondered, like, okay, so if this is their schedule of biting, what happens like
So
in
wait, let me
between?
continue. There are
Okay.
2 other kinds of mosquitoes. The Culex mosquito, they don't have much diseases, but there's another one, the what they call this, the Anopheles mosquito. That
Okay.
one brings malaria. So it's not everywhere. It's only in particular areas of the country, and they bite at night. Oh, may schedule rin sila. Nocturnal sila.
Hilarious. You get
Night
that at
duty.
night.
So don't go about timing like what time is it? I have malaria because it's it's not like that. Just wear long sleeves.
Right,
And this is
right.
the challenge. It's getting hot now, so you can still wear long sleeves. Just make sure that the clothes are light.
Yeah.
Yes,
Wag naman yung jacket na sobrang kapal.
yeah,
So
yeah.
make sure it's like a light, breathable. And the
fabric.
colors should be light colored.
Okay.
Because dark colors, like what Paolo is wearing now, will attract mosquitoes.
mosquitoes.
Wait, maghubad na
Yes.
ako Wait lang.
Hold on.
Take it off.
Oo, pero no, it's pero of course when we're talking about all of that, you mentioned it a while ago, so may konting schedule, pero when you see them, syempre walang no contact apprehension, apprehend mo talaga.
Yes.
But what advice do you have for those now knowing that may schedule sila? Does that affect the way that we have to really
Schedule
fix the
things,
environment
like,
and
And
of course
a follow-up question to what Paolo's saying is just like the mosquito repellent, like the normal one. Is that okay
Yes.
with all variants?
Yeah.
Yes, that's okay with all the 4 species of mosquito. And the practical question from Paolo, if you're using Katol or the electric mosquito repellents, remember those are consumables. So you might want to plug them in or light them up around those times. Because if you light up or you plug in around 11 a.m., that's not the usual time when these mosquitoes bite.
Okay.
So if you want, and you're going to run out of Katol, run out of the electric repellents. So make sure that you, and even the lotions, by the way, they're not forever. Wala talagang forever. May hugot. So the
Join us for love hacks.
Yes.
Albert, next
So the
time.
lotions have to be applied around those times so that you can maximize their effect.
Okay.
tanggal yung cardigan ko. Tukutusin ako.
Well,
I am so
Paolo's
glad I
making you
asked that
bad.
question. It was really on my mind na the last time you were here when we talked about dengue. Like, kasi my lola would always say that talaga, yung mga lamok ng morning and late afternoon, yun yung may
Yeah.
dala ng dengue.
Pero
So-
malamig naman. I mean,
Well, while Paolo's making hubad over there, thank you again to our
Thank
fourth
you,
host,
Doc
Doc
Albert.
Albert, Domingo, for coming. It's a pleasure having you, and we'll see you probably love hacks because my hugot ka. So we can talk about that next time.
Sure. Thank you so much.
Thank you
you,
so
Doc
much,
Albert.
Doc Albert. Thank you so much. He's the Health Assistant Secretary, Doc Albert Domingo.